Hi, thank you for joining us in today's video. Today's video is about pharmacology questions. Let's have a look at the first question. A 65-year-old overweight man visits his primary care clinic for a routine checkup. His medical history includes type 2 diabetes mellitus managed with metformin. On examination, he's diagnosed with hypertension and lab tests confirm albuminuria. Which of the following antihypertensive medications would be the best first-line choice to also provide renal protection for this patient? Option A, hydralazine. Option B, lisinopril. Option C, metoprolol. Option D, nifedipine. Option E, spironolactone. The correct answer is B, lisinopril. Lisinopril is an ACE inhibitor and it blocks the conversion of angiotensin 1 to angiotensin 2, which normally constricts blood vessels, leading to higher blood pressure. ACE inhibitors, they reduce the intraglomerular pressure by dilating the efferent arterioles. Now, efferent arterioles are the blood vessels leaving the kidney glomeruli. This mechanism of lisinopril reduces the pressure in the kidneys and helps prevent further damage, making it ideal for diabetic patients with kidney issues. Let's have a look at why the other options are incorrect. Option A is incorrect because hydralazine dilates afferent arterioles, which are the blood vessels leading into the kidney glomeruli. This increases the renal blood flow and can lead to higher glomerular pressure. In a healthy kidney, this might not be a problem, but this pressure increase in glomeruli can be problematic in patients with diabetic nephropathy and albuminuria, worsening the kidney function. Option C is incorrect because metoprolol is a cardioselective beta blocker, meaning it specifically targets beta-1 adrenergic receptors in the heart. This reduces heart rate, cardiac output, and myocardial contractility, which results in lower blood pressure. Beta blockers, they do not have significant effect on the kidneys directly. Option D is incorrect because nifedipine is a calcium channel blocker and it causes vasodilation and a subsequent reduction in blood pressure. Nifedipine dilates the afferent arterioles, which are the vessels leading into the kidneys. This increases the renal blood flow and increases the glomerular pressure. This is problematic in patients with kidney disease because it can impair the kidney's ability to autoregulate blood flow and pressure, leading to further kidney damage. Option E is incorrect because spironolactone works by blocking the action of aldosterone, a hormone that causes the kidneys to retain sodium and water, which increases blood volume and blood pressure. By blocking aldosterone, spironolactone promotes sodium excretion and potassium retention. It does not provide renal protection as ACE inhibitors. Let's have a look at the second question. A 52-year-old woman with a long-standing diagnosis of high blood pressure is looking for over-the-counter options to manage symptoms of a summer cold such as nasal congestion, a runny nose, headache, and cough. Which of the following medications could potentially exacerbate her blood pressure? A, acetaminophen. B, codeine. C, dextromethorphan. D, diphenhydramine. E, phenylephrine. The correct answer is E, phenylephrine. Phenylephrine is an alpha-1 adrenergic agonist commonly used as a nasal decongestant. It works by constricting the blood vessels in the nasal mucosa and reducing swelling and congestion. Phenylephrine can worsen hypertension due to its vasoconstrictive properties. By stimulating alpha 1 receptors, it causes blood vessels to constrict, which can raise the blood pressure. Let's have a look at why the other options are incorrect. Option A, acetaminophen is a non-opioid analgesic commonly used for pain relief and fever reduction. It works by inhibiting the cyclooxygenase enzymes in the brain, specifically COX-2, which reduces the production of prostaglandins, a substance involved in inflammation and pain. Acetaminophen is not directly affecting the blood pressure. Option B, codeine. Codeine is an opioid analgesic and a mu receptor agonist that is commonly used to treat mild to moderate pain and also a cough suppressant. Codeine primarily works by binding to opioid receptors in the central nervous system, reducing pain and suppressing the cough reflex. Unlike the drugs that cause vasoconstriction, codeine does not directly affect blood pressure. Option C. Dextromethorphan is a non-opioid antitussive, meaning it is used to suppress cough. It acts on the N-methyl deasparate receptors in the brain to suppress the cough reflex. It has no vasoconstrictive properties and does not interfere with blood vessel tone or fluid balance. Option D. Diphenhydramine is an H1 histamine receptor antagonist, which is commonly known as antihistamine, and it is used to treat allergic reactions, hay fever, and insomnia. Diphenhydramine works by blocking histamine receptors, which helps alleviate symptoms like sneezing, runny nose, and itching. They don't directly cause hypertension or negatively affect the vascular tone, and this makes them safe for most patients with high blood pressure. This marks today's set of questions. If you liked the video, please make sure to subscribe and give a like to support our channel.